which I forgot to do before. Chip Carson is a very rare professional. He is a PhD in toxicology and also a physician. And for physicians to have the knowledge and the training to ask questions about the environmental factors in illness is very rare and really important, more and more important than it's ever been. So we are really proud to have Chip here tonight to speak to our club. As you may have heard earlier in the meeting, Chip grew up in Cincinnati. He went to Kilgore and then to Walnut Hills High School. He got his undergraduate and PhD degrees at the University of Cincinnati, his PhDs in toxicology, and then went to medical school at Ohio State and did a residency in both internal medicine and also occupational medicine. He has taught in occupational and environmental medicine and served on the faculty at 3 major universities in the United States and has served as a consultant to the World Health Organization and to many governments and community groups trying to get to the bottom of environmental problems. He has also provided expert testimony in a number of cases in court having to do with occupational and environmental exposures. So he brings a tremendous amount of background to this. Chip has worked on research and problem solving in Western Asia, Indonesia, South Africa, and Latin America. And this is a wonderful set of skills to bring to being a Rotarian. He joined the Rotary Club this past year and has a tremendous curiosity about cultures and a great love of people and a great dedication to improving people's health and well-being. So he has great humanitarian skills to bring to the talk tonight. I would like to mention that all of these talks are being recorded and they're being posted on the Cincinnati Rotary Club's YouTube channel. The link is in the chat. I'm also putting up a link to the first annual report on the 2030 district that Tom Schultz talked to us about at the last session. And I want to encourage you to attend the next 2 sessions, January 19th on relieving the energy burden of tenants and January 5th on converting solid and liquid waste into energy. So now I'm going to turn it over to Chip Carson with gratitude and ask everybody to please mute while he's talking. Then we'll have time for questions after he's talked.
Well, thank you very much, Ariel. I'm really honored to be part of this series. I attended the first 2 sessions and they were excellent. This one is going to be a little bit different because I'm going to be talking a little bit outside the Cincinnati community for much of my talk about the general effects of climate change on children's health. And if you'll give me a moment, I'm going to try to get my screen shared here. Okay, we had a little difficulty in our dry run, and I'm not able to run the presentation. So I'm just going to flip through the slides manually, but hopefully everyone will be able to see what I'm talking about. The main theme of this talk is the fact that climate change is the greatest single threat to the health of children worldwide. And I'm going to try to support that with information for you coming up right now. The reason this is true is because it's a modulator of environmental hazards to children's health, the things that they're susceptible to all the time anyway. And it is important as a widener of the disparities that adversely affect the health of children. And some of those things are listed below on this slide: poverty, heat stress, catastrophic weather events, vector-borne diseases, undernutrition, inadequate living conditions, and socioeconomic disadvantage. I'm only going to talk about numbers 2 through 5 there in this talk. We can discuss the other socioeconomic issues at another time, which are very important in the occurrence of illness, disease, and lack of good health. But I'm going to concentrate on the climate change aspects in this talk. First of all, let's talk about the heat stress aspect. The background of this slide.
What are you doing?
Is this is actually from NASA, that shows a graph of global temperature rise over time, starting in 1880 at the left and going to 2020 at the right. This is just to show you that there has been a steady, gradual increase in temperature that seems to be getting steeper and steeper as we come up to the present time. And predictions are that this change will continue to occur and accelerate over time. There were a couple of important publications that came out in the last decade or so. One was the first one listed here, by O'Neill and Eby in 2009. It was a University of Michigan study that was that related temperature-related morbidity and mortality for the year 2007 United States National Assessment on Impacts of Climate Change and Variability on Human Health. And part of that study was an examination of the scientific literature on the subject that was published after the year 2000, so 2000 to 2008. And it also found, based on review of that literature, that weather extremes and variability are likely to increase, and that there are specific vulnerable groups within the population, and among those groups are children. Children are a defined group, usually those 15 years old and under, who have special needs, special physiologies, and special susceptibilities that make them particularly susceptible to a number of the disparities that are widened by climate change and by temperature increases themselves. Also in that same year, the Lancet Climate Commission, which was a task force that was appointed with invitees, including the people who worked in this area from the medical and scientific communities, they filed their report. And their main conclusions were that the 50 years of public health gains that had been acquired back from 1970 all the way up to 2009 were being undermined by climate change. But the bright spot was that climate change itself and the health problems associated with it could be the greatest global health opportunity of the 21st century for science and politics. So this was a bright spot. And since that time, there have been dozens of other reports. These are just two examples, but there have been various research studies, task force reports, think tank white papers that have been published. And the message is always the same, that illness and death are linked with the warming climate, and certain subgroups are most at risk for the negative outcomes, and most notably kids. Now, children represent more than a quarter of the global 7.8 billion population of Earth. But they may pay a much higher price as a percentage. This is in terms of disease, death, famine, injury, and socioeconomic loss. Let's talk first about the most direct effects of climate change, higher temperatures. Increased ambient temperatures lead directly to heat exhaustion and heat stroke and dehydration with kidney injury in children. But less well appreciated is that they also lead to changes during pregnancy, and that increased environmental temperatures during pregnancy can lead to a host of adverse obstetrical outcomes, including preeclampsia, eclampsia, increased rates of stillbirth, preterm births, and term low birth weight infants. And these factors very often affect a child's growth, development, and resilience. As a matter of example, one Chinese study, which looked at over 2 million pregnancies, concluded that higher ambient temperatures were associated with a higher risk of preeclampsia and eclampsia associated with higher temperatures and leading to greater risk. These conditions are a threat to the lives of both near-term babies and to their mothers. The global incidence of preeclampsia has been estimated to be somewhere between 5 and 14% in all pregnancies, but in developing nations, it's as high as 18% and is the second most common obstetric cause of stillbirths in those countries, and also early neonatal deaths. Another study from 19 African countries, or looking at data from 19 African countries, showed that average temperatures and temperature extremes during pregnancy were positively associated with the occurrence of low birth weight at a level that was equivalent to the effect of not having electricity in the home, or the educational level of the mother. And both of those are known to be very strong socioeconomic effects in terms of child health. A 2011 study looked at 500,000 deaths in the warm seasons over a 23-year period in the Catalonian region of Spain. This is the area around Barcelona. And it looked at these deaths in relation to extremely hot days and heat waves. It showed a 50% increase in perinatal deaths directly associated with those heat waves. Synergies also are known to exist with air pollution. And when you put climate change and air pollution together, you have a magnification of the harmful effects on children that produces particulate pollution and oxidative stress pollution. These sorts of pollutants lead to impairment in cognitive and behavioral development in children, respiratory illness, and also other chronic diseases. And both of those factors bear a strong relationship with the exploitation of fossil fuels. So fossil fuels are given a lot of the credit for pushing climate change in the direction that it's going. But they are also the source of some of the pollutants that are made worse by global climate change. While various policies have been implemented globally to mitigate these climate change and mitigate these climate change and toxic air pollutants, policy assessments have considered few of the benefits to children in their development. So one of the well-appreciated features of increasing average global temperatures is the increase in both frequency and severity of extreme weather events. And let me see if I can. This is actually a slide taken in Houston when I was living there a few years ago. This is from my front door. And this was the flood that resulted from the Hurricane Harvey that went through there in August of 2017. This is a fairly affluent neighborhood, but there was sheer devastation as a result of this kind of flooding. This neighborhood is not even now back to normal. And that was 3.5 years ago. So I know firsthand that the effects of natural disasters like this can be very severe. And in those who have very few resources, such as the poor, the disenfranchised, those effects are multiplied and cause insurmountable issues, including health issues for the entire family. In addition to floods, cyclones and typhoons, droughts are also a problem. And these account for millions of deaths each year due to trauma, disease, exposure, displacement, and war. Many of the victims are children. Now, children play a disproportionate role in the health effects associated with climate change. And some estimates suggest that they bear up to 88% of the burden of disease that relate to it. Increasing average ambient temperatures are resulting in changes to the environmental ecology, with the result of encouraging movement of natural carriers of disease into new, larger areas previously not affected. In the next slide, this is a picture of a female Anopheles gambii mosquito. This is the mosquito that carries the malaria parasite and transmits it from person to person by her bite. This is a natural part of the mosquito's life cycle, and humans, the Anopheles mosquito, and the malaria parasite all evolved together over the last 100,000 years and are very intimately connected. Nonetheless, malaria causes a severe amount of disease and terrible cultural issues in many countries around the world. Children under 5 years old are one of the most vulnerable groups affected by malaria. In Africa, in 2016, about 285,000 children died before the age of 5, mostly from malaria and its associated issues. The majority of malarial disease and particularly severe disease with rapid progression to death occurs in these young children who don't have adequate immunity. And those are kids generally 3 to 60 months old who no longer have immunity from their mother, and their immune system is too undeveloped to be able to generate it well on their own. They suffer from extreme anemia, hypoglycemia, and cerebral malaria, which are features of severe malaria that are more commonly seen in children than in adults. Now, it's only recently been appreciated that some fever cases, especially in Africa, may be misdiagnosed as malaria, when in fact they're a different disease caused by a different pathogen. In the next slide, this is a different mosquito. This is the Aedes aegypti mosquito. And it and its cousins are responsible for transmitting a number of arbovirus diseases that the American public has become more aware of in the past decade. These include Zika, dengue, and chikungunya. Because these vectors have a slightly different optimal temperature and humidity biting behavior profile, they have begun to move into areas that were previously ravaged by malaria And as the climate warms and becomes wetter in some places and drier in others, the Anopheles malaria-carrying mosquitoes are also traveling to new destinations. In this next slide, what we see here is a depiction of Africa. Today on the left, in 2050 in the center, and in 2080 on the right side. The top row of continents shows the principal distribution of malaria carried by the Anopheles mosquito. And you can see that as the climate is warming, it's predicted that the malaria-carrying mosquitoes will begin to move and encroach further to the central African area by 2050, and then into the East African highlands by 2080. At the same time, on the lower row, the Aedes aegypti mosquito, which carries the arbovirus diseases, is going to be taking over areas previously ravaged by malaria and moving into sub-Saharan African regions all the way across the continent and Madagascar. So it's, I think it's important to point out that the Rotary Club has several projects going on in Africa, in Madagascar, in Uganda, and in Ghana, which, and it may be worthwhile to take this movement of disease and transformation of disease into account when Rotarians are thinking about those projects in the future. In any case, this is important to understand because this is not only occurring in Africa. The three arbovirus diseases that I mentioned, and there are others, but Zika, dengue, and chikungunya are also moving in other directions. They are moving from South and Central America up into the North American continent. And at this point in time, we have transmitted dengue and transmitted Zika virus in both Texas and Florida. And this is new in the last decade, but will be becoming more frequent as global temperatures increase and these mosquitoes find it comfortable to move further to the north. By the same token, these disease vectors are spreading through Asia and through Oceania as well, because they are finding more hospitable environmental conditions for them to propagate. Also, even though malaria is primarily transmitted by the Anopheles gambiae and a few other Anopheles species, in some places in the world, for example, India, it is transmitted by another species of Anopheles, which has a different behavior, lives in cooler and drier climates, and bites during the day. So things like mosquito nets are not much use when a mosquito approaches you while you're up and about during your daily activities. We should all be aware that these kinds of emerging diseases are going to be coming onto our shores in America. We had the encroachment of West Nile virus about 30 years ago in the United States, and that is now distributed throughout North America. Likewise, tick-borne diseases such as Lyme disease have spread throughout the continent and are essentially endemic in America at this time. So this is only the first refugees who are leaving areas of the world that they formerly resided in to find new lands and new opportunities. And unfortunately, Americans are some of those opportunities. I don't need to explain how the lack of rainfall. Oh, before I talk about that, let me talk about this one additional pathogen. This is, you see on the top of this slide, a bug that's called the kissing bug. This is native to the Americas, mostly in northern South America and Central America. And it carries a parasite that you can see in the center panel of this photograph, which is called a trypanosome. And these bugs will bite humans. And when they do, they may release some of these trypanosomes into the wound that occurs, and that causes a disease known as Chagas disease, which can have serious cardiac and neurologic consequences. So the kissing bug is given its name because it's often found sitting on a person's face who's fallen asleep and perhaps drinking saliva from the corner of the lip and taking a blood meal from a bite. But this is one way that this pathogen is transmitted. While the last few years I was in Texas, I would take graduate students into fields around Houston, and we would capture various insects and then speciate them when we got back to the laboratory. And we would always be able to find several varieties of these kissing bugs, many of whom were infected with this trypanosome. And so this is a new disease opportunity that has developed in the southern United States. And as climate warms, it will be moving farther upward in North America as well. Lack of rainfall, when it's extended and severe, results in severe drought and affects agricultural communities and the cities and the nations they support very drastically. We've seen on the news over the years various reports of international conflicts and local disruptions, famines, disasters due to extended drought. When the rains don't come, neither do the crops. They wither and die, and people and livestock starve. And this leads to refugees, migration, conflict, and violence. And again, children here are the victims often of both the starvation, the loss of identity and place, and victims of conflict when that develops as well. These are all due to changes in climate, some of which are cyclic, but all of which are getting worse. We know that weather conditions are becoming more extreme as the temperatures slowly rise. We went almost entirely through the Greek alphabet, naming hurricanes in this past season, which has never happened before. And I expect next year and the year after will be a similar thing. We're going to have to find a third alphabet to go into. But we sitting here in Cincinnati are fairly protected at the moment. We do have vulnerable populations who are already suffering as the result of heat stress in apartment buildings in heat islands that don't have air conditioning, where people languish during the summer months. We also have we have issues that make this worse, such as food deserts in those same areas that encourage poor nutrition and makes people more susceptible to the effects of heat. But we as individuals can make a difference. And one of the very easy things that we can do is each and every one of us can reduce our carbon footprint. We can drive less. We can reduce, reuse, and recycle as much as possible. We can demand better and more inclusive recycling opportunities. For example, the City of Houston recycling system only is able to actually recycle about 50% of the materials that are sent to it in residential recycling containers. The rest of that is reverted back to the regular landfill. But much more can be done if we employ modern and better technologies and better understanding to make these systems work. You can also purchase 100% renewable source energy. The electricity deals that the city of Cincinnati has negotiated and make available to all citizens of the city are 100% renewable source energy. Every kilowatt hour that you buy through that program, delivered to you by Duke Energy, is accounted for by at least 1 kilowatt hour of energy generated by solar or wind or some other renewable source. You can also consider an electric vehicle. This is just about the time where people are going to be going like gangbusters into electric vehicles and leaving their internal combustion engine vehicles behind. The Tesla company has just overtaken all of the other automobile manufacturers as the financially most significant automobile manufacturer, and it's all electric. Also consider geothermal or solar power for your home and your business. This is a step that I haven't been able to take yet, but it's something I'm considering for the fairly near future. Another thing you can do is speak up. You can start a conversation. Just talk about this with friends, with acquaintances, business associates, whoever will listen. You can write a blog. If you reach a milestone, tweet about it. Let people know that you're happy and proud about being able to achieve something relating to energy independence and reducing our dependence on fossil fuels. Share a post about it. Network with others. And the third major thing you can do is get involved with an organization that has this as a central focus. I'm happy that the Rotary Club, of which I am now a member, is heavy into responsible sustainability. I'm very proud of that, and I think they are moving even more in that direction. So the overall message is that as the climate warms, children's health is going to be impacted very severely from multiple different sources. And it's going to happen faster and faster as time goes on. We can slow that down by pulling away from fossil fuels as quickly as we can. That's sort of the mask wearing aspect of this, to use a COVID-19 and start letting the population know that it's okay to be interested in conservation and to be interested in another way to do things. And then we can actually do things like the Rotary Club is doing in 3 countries in Africa, and will be doing more in the future. Number of other organizations are doing. We heard of from the Green Umbrella Organization a couple of weeks ago in this series about sustainability and clean energy in the Cincinnati area, and it's something that should be our responsibility as a community at this point. So I want to thank you for listening to this presentation. And if there are any questions, I'll be happy to try to answer them.
Thank you, Chip. I'm going to ask everybody to unmute themselves and really appreciate it. I'd like to ask you a question to start off, please. You mentioned that this climate crisis gives us a great opportunity, as well as creating a great hazard. Could you say a little bit more about where you see the opportunity and how we can avail ourselves of it?
Well, that report, which came out in 2009, saw that there were a number of areas in which communities and individuals could be involved, primarily in shifting attention away from fossil fuels to the use of sustainable and renewable energy resources. They also noted that the ability to establish networks and political coordination to make this happen more rapidly was a great possibility. And the Paris Accords were one of the outcomes of these attempts to establish international political networks to agree on a plan and shared resources whereby these great endeavors could be accomplished. Unfortunately, although many big strides have been made in that area, the United States has somewhat lagged behind in that area, among other things, withdrawing from the Paris Agreement and continuing to promote fossil fuels in some areas as the best way to manage our economy and preserve people's livelihoods. So this is a policy decision that I believe may have been an error, but it's one that we may be able to revisit in the near future and move forward more aggressively on.
Thank you. What other questions do people have for Chip?
I've got one. I read recently that General Electric is making a new wind turbine that is perhaps 10 times bigger than wind turbines have ever been before. And they're hoping that this is going to really be a game changer. I mean, it'll probably be more on, placed in the ocean than on land. But it's just encouraging that renewable technology just keeps moving forward.
When I left Texas, almost half of the electrical energy generated in Texas was from renewable resources. This is from the land of the oil well and the roustabout.
That's the coal mine museum in Beckley, West Virginia, being powered by solar panels, which it is.
Well, that's great. But in Texas, even though they have, it's a very red state. It's very dependent on fossil fuels in a lot of ways. the University of Texas, where I was a faculty member, has a huge endowment from oil and owns a lot of oil lands, but they have moved forward with the promotion of renewable energy in a very successful way. They've done it profitably and they've done it efficiently. And people have not been thrown out of work. And we have not come to doom as a result of it. And people are driving electric cars around in Texas too. There's almost as many electric cars as there are pickup trucks. Not quite, but almost. So we continue to move forward.
I would like to remind people that one of the neat things that Oliver Kroner pointed out in the first talk for this series is that even though the United States is not currently participating in the Paris Climate Accord, that most of the carbon emissions in the world occur in cities, and most of the world's population lives in cities. So he said that cities are a great place to solve this problem. And that's why I'm really excited that we live in a city that started working on this in 2008 and has got a great head start. So we're kind of in a learning lab here. I feel we're on a cutting edge as a, an American community that's trying to live more responsibly and to use our weight as consumers in a more constructive direction.
Yeah, well, this is not by the way so much of a question as a comment, but I think I remember that Duke Energy is going to install one of the largest solar arrays yet in existence east of Cincinnati in Highland County, where my siblings and I grew up, simply because there's more cheap land there than there is closer to Cincinnati.
This facility is a project of the city of Cincinnati, and they've done it through a power purchase agreement. Maybe Ken Wright can talk a little bit about how that works.
Yeah, I'm not totally sure about how all this works because governments can do things that companies and individuals can't, but they are able to build this large system out beyond their city limits and sell the power to the grid and get basically credit for it. Through a power purchase agreement, they can get investors who can take the tax credit break, the investment tax credit, which is just, as Ariel indicated, just been extended. And that reduces the cost of the whole system to the investors and then to the people who buy the electricity. So that makes it much more economical. That and the fact that it's a huge field, a huge setup so that they're buying in large quantity, which also helps reduce. So yeah, it's a project of the city, as Ariel says. I don't know what Duke's involvement is, except probably to have to agree to transport the electricity from Highland County to Cincinnati.
Thank you for the clarification, Ken. I appreciate that.
Yep.
I have a question. The Rotary Club, this project, we have a project that we're going to choose for a club. And one of the things that we've talked about a lot is, and I think that I wanted to hear everybody's thoughts about this, is the way we begin to expose our children to the environment and to teach them about the responsibilities for environmental care make a big difference into what happens in the future. And so, we have a couple projects. We have 3 great projects we're considering, and at least 2 of them I know of have components where it involves exposing children to more nature and to try and teach children about tree planting and other aspects of nature. So it seems to me that until we get we need to get the educational components at the very earliest levels of education right in order for children to understand what we're trying to do, some of the effects that they will experience if they don't have, some control over climate, if we don't have some control over climate. And I just wondered if anybody has any thoughts about that.
Well, I can respond with
I did.
a couple of anecdotes, but I think the children in schools in elementary schools today are some of the greatest proponents of environmental conservation, more than I would have believed. I've had a couple of wonderful experiences of being invited to elementary schools to give demonstrations or just talk to them about environmental health. And these kids are very enthusiastic and quite knowledgeable about methods and practices to save the environment, and are very appreciative about the overall value of the environment and its ecology in sustaining us as well as the rest of life on Earth. And that's been very encouraging to me. Anything the Rotary Club to do to put a support to that kind of thing would be supported by me. I think that's great.
Well, I think that I agree with you. It is young people and they have had exposure to this. But I also think that one of the things that we're considering in our projects is that in the Cincinnati public schools, there are a lot of kids that may be being taught about the environment, but don't live in very healthy environments themselves. And one of the projects is trying to expose children to more nature experiences, because a lot of children just don't have access to parks. They don't have access to, trees in their yards or grass or anything like that. And so, that is also a part of appreciating nature, is having positive exposures to planting trees, to knowing how to build a garden, to whatever it is that we decide we end up doing. And I just want to bring that up too. I think it's great, but I think there's a lot of kids that don't have the same advantages and may not be being taught about environment, and also may not in their own personal lives be exposed to environment in the wonderful ways that some of us have, so that we say, or we've seen the great sights of nature,
This is Kathy Downey. I have a question for Chip. There's a lot of organizations that are doing a lot of good things with the climate, with the environment. Is there an organization that you feel is doing the best job, as far as if I was to donate money to help children in underserved areas with health problems? I mean, there's Sotini, and then there's organizations, a variety of organizations. Do you have any that you would particularly recommend?
Well, you can find organizations doing work at all levels. There is a foundation here at Children's Hospital, which has a major focus on environmental health as a factor in children's health. And I don't recall the name of the foundation at the moment, but I can be happy to find that for you. And you can go all the way back to organizations like the Nature Conservancy, whose goal is much broader and attempts to acquire property and allow it to be maintained in a sustainable manner, maybe peeling away layers of human civilization that has tarnished the natural area and allowing it to recover to its natural state. So you can find organizations at both ends of the spectrum.
I'd like to add something to that too. If you are a Rotarian, or like what Rotary is doing on humanitarian work, Rotary is now setting up a fund to make grants for environmental projects. And in the meantime, while waiting to give to that, ESRAG, I'll put that in the chat, is a network of Rotarians working on environmental sustainability, and they have carbon offset funds that you can donate to that will be put aside for grants for matters like planting orchards so that people can have both trees and crops, or other kinds of environmental and sustainable projects like the solar project in Uganda that this Rotary Club is supporting through SUN. So that if you wanted to make a kind of practice of offsetting your carbon emissions by making donations like that, there are a number of carbon offset opportunities where the organizations use the money for environmental rehabilitation and remediation. Nobody's going anywhere on a plane, but in the future, when you're flying again, you can find online calculators and figure out how much you should donate to offset the fossil fuel impact of your flight, and that money would be used for environmental projects.
Hmm.
I have a consumer question. So should we be buying electric cars, or should we be going halfway there and buying plug-in hybrids?
It's a difficult question. One of the main reasons that electric vehicles have had a hard start, so to speak, is because people have what's called range anxiety, realizing that once they leave their driveway in an electric car, that they're going to have to make whatever trip it is and then come back home before they run out of electricity in order to recharge. This was a big issue at the beginning, but currently the issue of electrical vehicle recharging is not such a big one because there are many, many electric charging stations around. There are industry standards for them. So electric cars of different makes and varieties can all be charged in the same charging locations. I charge my car in the Kroger parking lot sometimes while I'm doing my shopping. So it's they're all over the place. And if you have a Tesla, for example, Tesla will also make sure that you know where the various charging stations are if you're going on an extended road trip, so that you can plan your trip to be near a charging station when you need it. And they charge so fast that you only have to take a break, maybe eat lunch, maybe have a Coca-Cola and a sandwich, and your car's all charged up and you can move on. So in the near future, we will probably have a sufficient number of electrical charging stations. So it'll be very similar to the way it is now with gasoline stations. You won't have to worry about knowing where the next one is, because you know there will be one right around the corner.
I was very surprised. My neighbor's son drove here from the West Coast in an electric car. And my neighbor said it's exactly what happened. They had a Tesla and they went online and found out where these charging stations were and did it. And it works. So it's quite possible. But I would say, frankly, plug-in hybrids or even hybrids are good things. Anything to cut down the gasoline consumption is a good thing.
Yeah.
Well, I've been told by my godson, who is a Tesla freak, that there are actually reliability problems with Teslas, that they tend to require frequent repairs and outstanding maintenance.
My understanding is that those problems, which are in a new technology, and you expect there to be some problems in new technologies, they're no different from the kinds of problems you have currently with internal combustion engine cars. And in fact, one advantage of electric vehicles is they're much simpler technologically than internal combustion engine cars are. They have many fewer moving parts and are easier to repair. So I think those rumors are going to be dispelled simply by preponderance of the evidence over time.
Thank you.
Do we have time for one more question?
Can you guys hear me? Okay,
Yeah.
great. Well, first of all, I want to thank Rotary. I want to be a Rotarian. I've got friends in Arizona that do amazing things with their Rotary group. And if you don't know, my name's Dana, and I have this influencer organization called Keep Cool. And we're going to have a climate relay. If you're looking for a project, we need volunteers to basically walk these routes with the air beam sensor. Air beam measures heat and particulate matter in the air. And it's very interesting. We're finding that our east-west streets are warmer than our north-south. And some of our hottest places are playgrounds. Like the temperature really spikes because they're heat islands. And I need volunteers to help me with this. So if you want to add to the type of data that Chip is using, Chip, if you want to be involved, wait, is it Chris or Chip?
It's Chip.
Chip, okay, good. And anyway, so I don't really have a question. I just thank you for what you're doing. I'm working with the CCTST and some folks from DAP, and I've been paired with, as a community partner with some other people. But Chip, I would love to have, make our fledgling organization and volunteers available if you were to start looking for pathogens and insects in Norwood. I mean, we would love to know more, even though it's mostly bad news, right? So,
well, knowledge sets you free. So, yeah, if you would forward your contact information, Dana, maybe through the Rotary office.
Right.
We can connect.
And I can, right. We are, my lead researcher is with We Engage for Health. And so I'm their community partner, and I have a page on their website, and there's, some meetings and graphics. And of course, with the pandemic, we've just had a heck of a time getting things off the ground. But now it looks like we're going to be smooth sailing here in January. So I will connect with Ariel, and she'll disseminate the information. Is that how that works? So anyway, thank you. I didn't mean to do a big plug at the end here, but.
Well, Dana, you actually brought up an interesting, even though you didn't ask a question, you led to one, because there are a lot of people who are now doing what's referred to generally as citizen science, where they will obtain some sort of measuring equipment or some sort of checklist that allows them to do actual science on their own that then contributes to a larger project and results in real understanding and learning. Environmental pollution measurements are one of the things that have really done well in terms of citizen science, and we've learned quite a bit from it. I was involved in a number of citizen science projects in Houston, but I'm not aware of what's going on in Cincinnati since I've been here. But
okay,
we could keep our eyes open for as well.
Yeah, and I think we should.
Okay.
We have high school students in groups called Interact Clubs, and they haven't been meeting this year because of the pandemic, but maybe by spring they'll start to again. And this would be just a fantastic hands-on project for an Interact Club together with adult Rotarians. And Dana, we'd love to talk to you. I found your email on the spreadsheet, and I've put it in the chat here. keepnorwoodcool@gmail.com, correct?
That's right. That's right. Thank you so much. And we have some in Norwood. There's a lot of groups trying to do a lot of different things, And of course, when it's research, I keep telling people there's no agenda. It's not a political agenda. We're just trying to gather information. And you may have learned over the years that nothing in Norwood is easy. So fortunately, we have friends at Green Umbrella and DAP and UC Health and Children's, and but I need more volunteers. And you're absolutely right, Ariel. It's a very much a way to sort of introduce STEM and research methods. And if you just have an interest in your community, so we have the climate relay with the airbeam sensors, but then Melinda Bush-Kovacic, who's one of these researchers, she's developed this Eyewitness community survey, which is it's just like a whole, I won't take your time, but we do have a training day with the airbeam sensors. It's very easy. They're paired with Androids, and then the Android is like your computer that is reading like by the minute what you're breathing and the heat you're experiencing and the humidity. And like I said, it's interesting and it's alarming. And sometimes I thought we were going to see a lot of particulate matter, say, at intersections, and it really wasn't that bad. The particulate matter we're finding in Norwood comes from buildings. Mm-hmm. So anyway, it's a great way to learn about what's going on where you're sort of at the center of it, citizen science-wise, just like Chip was saying. So anyway, thank you, everybody. I won't take up any more of this meeting.
That was really exciting. I see we have one more question. Was it you, Peter, who had a question?
I did, and it was somewhat related, I guess, to this last item, and that is that, there are areas, I don't know if Norwood's one of them, but there's areas around the Mill Creek Valley in Cincinnati where childhood asthma and other childhood illnesses are substantially higher than the rest of the greater Cincinnati community.
Right.
And, I've heard that it's directly related to the environment in that area, the air quality in that area, perhaps, or something else. But I was just wondering if that was part of anybody's research, or if you're aware of any remediation efforts in that.
The University of Cincinnati has been mapping neighborhoods that have been redlined and overlaying maps of heat severity and incidence of diseases. So they have been doing that research, and that research informs a lot of what the next pair of speakers are going to talk about. They're going to be talking about energy burden on tenants. And it turns out that tenants living in those same neighborhoods can pay as much as 30% of their monthly income on their utility bills and have worse health and worse socioeconomic status and more heat stress and so forth. So yeah, the University of Cincinnati is researching that and mapping it. And our next two speakers are going to be talking about some very exciting solutions that the city of Cincinnati is promoting with landlords and tenants to try and make people's apartments more endurable and their utility bills cheaper by using less electricity.
Yeah.
Want to thank everybody for coming tonight, and to particularly thank Chip for the time and care he put into putting together this talk for us. Very excited by the networking that Dana's begun and about the wisdom of the people in this group. And I think we're going to have a lot of adventures in the coming years as we work together to make our own lives and our city more sustainable. Thank you all very much. Thank you to Melinda for welcoming us, and look forward to seeing you in 2 weeks. If you can join us again to hear from Savannah Sullivan and Carla Walker about tenants and how to make their lives better.